I'm Lynda Balneaves. I am the Associate Dean of Research and a full professor in the College of Nursing. And my research focuses at the margins of healthcare and the margins of medicine. I am interested in the use of complementary and integrative medicine, particularly in the context of people living with cancer. I'm also interested in Canadians' use of medical and non-medical cannabis, how they access it, how policy changes have impacted them, and how can they make informed decisions around the use of cannabis. It all came back to me being an undergrad nursing student many years ago, where I would have a patient, say to me, hey, do you know anything about acupuncture? Do you know anything about this natural health product? And I realized that I'd never learned anything about these therapies. I didn't know how to talk to patients about it. And when I started looking up the evidence, I was surprised, number one, that there was evidence, and realized that there was a real gap in care, that people need to have a place to have these conversations in a safe manner, that they're going to be respected in having those conversations, and they're also going to be getting good evidence to inform these decisions. I think what's really exciting right now is we're actually seeing the research that we're doing, the evidence that we've been summarizing is actually moving into care. We are developing guidelines that are changing how practitioners are practicing, how they're talking about these therapies. We're partnering on clinical trials where we're going to be generating that evidence that's so urgently needed. So it's just a really exciting time to almost be part of that shift in how complementary and integrative medicine, as well as medical cannabis, is being perceived, being taken up, and being understood by the larger healthcare system. And then the flip side is seeing that the patients and their families are finally getting the knowledge that they require and that they can have these conversations without being stigmatized and being able to kind of have very comprehensive care.